Hello, this is Kim Jong-dul. Today's topic is extraction treatment according to POP. POP is largely classified as normal and steep. POP can be maintained throughout orthodontic treatment, and in some cases POP is changed during the course of treatment. How do the teeth move when POP is changed? This patient had a normal UOP of 10 degrees and a normal POP of 11 degrees. Since this patient had a class 1 molar K, I treated this patient with the extraction of upper and lower first premolars. Especially when the lower first premolars are extracted, the first molars do not move much, while the incisors are retracted by a large amount. As a result, YON to FH change from 115 degrees to 100 degrees. In case of a normal POP, the treatment can be finished while maintaining POP by extracting the lower first premolars. This patient had a normal UOP of 12 degrees but a steep POP of 19 degrees. Canine and molar keys are class 1, and there is an anterior open bite and lip protrusion. I used to extract the upper and lower first premolars in this type of malocclusion in order to maintain class 1 molar K and maximally retract the incisors. As a result, lip protrusion and anterior open bite were resolved and favorable occlusion was obtained. But did POP change? POP was still 19 degrees and not changed much. Consequently, excessive linguversion of the upper incisors occurred, as can be seen by the change of YON to FH from 121 degrees to 97 degrees. In case of a steep POP with class 1 molar K, the lower first premolars are extracted if POP is to be maintained. When steep POP is maintained, the upper incisors are inevitably extruded and lingually inclined, ending up in an unaesthetic position. This patient had a normal UOP of 12 degrees and a normal POP of 12 degrees. Despite the normal POP, the lower molars were moved forward and POP was slightly flattened to 10 degrees. YON to FH change from 119 degrees to 106 degrees. Even in case of a normal POP forward, movement and uprighting of the lower first molars allow the upper incisors to be located at a more aesthetic position. This patient had a normal UOP of 11 degrees and a steep POP of 18 degrees. How should this patient be treated? Steep POP needs to be flattened, and normal UOP can be slightly steepened. As a result, YON to FH change from 129 degrees to a normal value of 113 degrees, and favorable occlusion and profile were achieved. Steep POP should not be maintained but flattened to normal inclination, so that the upper incisors can be moved to a more aesthetic position. Whether to maintain or change POP is an important consideration in orthodontics. When POP is to be maintained, usually the first premolars are extracted in the lower arch. Extraction of the first premolars leads to a large retraction of the incisors. As a result, UOP becomes steeper due to extrusion of the upper incisors, and the upper and lower molars move forward minimally. On the other hand, steep POP needs to be changed by extracting the second premolars in the lower arch. When the second premolars are extracted, the amount of anterior retraction is less than when the first premolars are extracted. However, because of the molar forward movement, the upper incisors can be placed at a more aesthetic position. The amount of incisor retraction is larger when the lower first premolars are extracted. As shown in previous cases, the upper incisors were significantly uprighted when POP was maintained. On the other hand, when POP was changed by the extraction of lower second premolars, yon to FH, as well as IMPI changed to normal values. The change in the premaxilla should be taken into consideration in orthodontic treatment. It is less of a concern in growing kids but requires attention in adults. In A, the total alveolus is remodeled and moved posteriorly as the upper incisors are retracted. However, in B, only the midroot and marginal alveolus are remodeled, while the bone at the level of the apex does not move as much. The movement in A is desired, but it is not often seen in clinical practice. Rather, in clinical practice, most of the movement is like B. The premaxilla should be evaluated in extraction treatment. Narrow premaxilla are often observed in high-angle, open bite, and low CF cases. On the other hand, wide premaxilla are common in low-angle, deep bite, and high CF cases. In wide premaxilla, the upper incisors can be retracted without much problem. But retraction of the upper incisors should be carefully carried out in narrow premaxilla. If POP is maintained by extracting the lower first premolars, the upper retractions will be retracted too much and become prone to root resorption. On the other hand, change of POP by extraction of the lower second premolars, despite the less retraction of the incisors, results in better aesthetics and lower chance of root resorption. What about aesthetics? When steep POP is maintained, extrusion and linguoversion of the upper incisors are inevitable. However, if steep POP is flattened, or in other words, the mesially angulated lower second molars are sufficiently uprighted, the upper incisors can be placed in a more aesthetic position. Let's take a look at the relationship between POP change and TMD. In A, the upper and lower incisors are maximally retracted without any change in occlusion of the premolars and molars. Then what happens to the TMJ? The craniofacial complex is a changeable structure. Therefore, the condyle is likely to be pushed backwards as the upper incisors are retracted. On the other hand, when steep POP is flattened, the molars are moved slightly forward, and in turn the amount of anterior retraction decreases. However, due to the molar forward movement, the mandible is likely to be moved forward as well. In other words, maximum anterior retraction without any change in POP can contribute to the development of TMD. These diagrams show the relationship between the closure of extraction space and tongue volume. Bone shows maximum anterior retraction without any positional change of the molars. B2 shows simultaneous retraction of the lower incisors and forward movement of the molars. As you can see, there is more tongue space in D2 than in bone. Of course, it is much easier to provide tongue space in a non-extraction treatment. But in an extraction treatment, tongue space should be maintained as much as possible by POP change and molar forward movement. Simply put, steep POP should be flattened. How do many orthodontists approach this? Recently, they attempt to upright the lower molars and maximally retract the lower incisors by the use of mini-screws. The posterior occlusion is formed in this abmaxillomandibular triangle. When the posterior occlusion is moved anteriorly or posteriorly, it is necessary to evaluate the positional change of the mandible. That is, anteroposterior movement can accompany vertical movement. What happens when the lower posterior teeth are moved posteriorly? The mandible is likely to be rotated clockwise, which is adverse in case of a class 2 malocclusion. On the other hand, when the posterior occlusion is moved forward, the chance of forward movement of the mandible increases, which is a favorable response in the treatment of class 2 malocclusion. Many orthodontists attempt to upright the molars and maximally retract the incisors. However, we need to change our view. The molars should be moved forward and then uprighted. Many are afraid to do so because the molar forward movement can easily lead to mesial angulation, which is undesirable. Nonetheless, some degree of mesial angulation of the molars can be resolved by uprighting with MEIW. Let's take a look at these three cases. In all three cases, premolars were extracted, and favorable profile and occlusion were obtained. But what is the response of the mandible to the treatment? In A, hypulhegia was used to distalize the upper molars, and the mandible could be retruded. In B, the red circle that represents the posterior occlusion is smaller, meaning that mini-screws were used to intrude the upper molars. As a result, the mandible can slightly move forward. In C, the molars were moved forward and then uprighted with MEIW, and favorable occlusion and profile were obtained consequently. What kind of tooth movement occurs when POP is not changed as in A? The upper incisors are inevitably extruded and retroclined. So POP should be changed as the incisors are retracted. However, many orthodontists treat as in A, resulting in an unaesthetic gummy smile. Consequently, mini-screws are used to intrude the upper incisors. Let's take a look at C. The treatment is much easier if the mesially angulated molars are uprighted and POP is flattened. But without POP change, the roots of the upper incisors are resorbed, as they are pushed toward the maxillary cortical bone. As you can see, there is a close relationship between premolar extraction and occlusal plane change, and steep POP should be flattened. When flattening steep POP, the first premolars can be extracted, and the second premolars, first molars, and second molars can all be uprighted. But it is difficult to upright three teeth. On the other hand, it is much easier, with extraction of the second premolars by allowing forward movement of the lower molars and uprighting two teeth. The blue line represents UOP, and the red dotted line represents POP. When the first premolars are extracted, there is not much change in POP. But POP can be effectively flattened with the extraction of second premolars. So keep in mind that the lower second premolars should be extracted in case of steep POP. Let's take a look at the movement of the upper and lower first molars. The distally angulated upper first molars are uprighted as they move mesially. The mesially angulated lower first molars should be uprighted and intruded as they move forward. In other words, the force should be applied in a counterclockwise direction. Thereby flattening the occlusal plane, the molar forward movement makes the treatment easier. In an extraction treatment, TPA and miniscrews are typically used as anchorage reinforcement. In order to maximally retract the incisors without molar forward movement. Is this kind of treatment necessary? Not in MEAW orthodontics, because the molars are allowed to move forward. Only under certain circumstances are the TPA and miniscrews used. By flattening steep POP through molar forward movement. Retruded chin can be slightly protruded, and the incisors can move into more aesthetic positions. These diagrams show the relationship between space closing methods and occlusal plane change. After premolar extraction, power chain or elastics can be used in the same arch intrarch, and this is called Class 1 elastics. Is there any occlusal plane change in this case? There is almost none, and curve of Spee can be formed by mesial angulation of the molars and distal angulation of the anterior teeth. Another way to move the molars forward is to either use miniscrews as indirect anchors for the anterior teeth to protract the molars, or to move the molars forward directly from the miniscrews. How does occlusal plane change in this tooth movement? It is steepened. In order to prevent this steepening of occlusal plane, hooks can be used to move the teeth in the same line as miniscrews. In this case, there is almost no change of occlusal plane, and the tooth movement is not easy. Consequently, the treatment duration is likely to be significantly increased. Let's take a look at the molar forward movement in detail. In occlusal view, the molars will be mesially rotated first-order bend. In lateral view, the molars will be mesially angulated second-order bend. In frontal view, the molars are likely to be lingually tilted third-order bend. And these movements have to be prevented by derotation and terotation in the first-order bend, distal uprighting in the second-order bend, and buccal uprighting in the third-order bend. So what kind of appliance should be used in order to produce these types of tooth movement? Many orthodontists use the SWA appliances. What happens when the SWA is used and the molars are moved forward? The first-order bend is good with the SWA because derotation bend prevents the mesial rotation of the molars. However, in the second-order bend, the molars are likely to be even more mesially angulated as they are moved forward, because plus 2 degrees of mesial angulation is programmed in the SWA brackets. How about the third-order bend? Since crown lingual torque is programmed in the SWA lower molar brackets, the forward movement of the molars can lead to more lingoversion from cortical bone anchorage. On the other hand, how do the teeth move with the KIMS brackets in MEAW orthodontics? Let's take a look at the molar forward movement with KIMS brackets. In the first-order bend, KIMS brackets are programmed with derotation bend just like the SWA. However, in the second-order bend, -5 degrees of distal angulation is programmed which upright the lower molars. In the third-order bend, 0 degree of torque allows more buccal uprighting compared to the SWA, making the molar forward movement easier. Therefore, in premolar extraction cases, proper first, second, and third-order bends can be achieved by the use of KIMS brackets. Steep POP is one of the fundamental characteristics of Class 2 malocclusion. If steep POP is maintained in an extraction treatment, linguversion of the upper incisors is inevitable. However, flattening POP by the extraction of second premolars can make the treatment much easier. In orthodontic diagnosis, I advise you to classify UOP and POP into normal UOP, normal POP, and normal UOP, steep POP prior to deciding extraction option and treatment planning. Thank you for watching.